This is Stacy Babka doing assessment video 1. So I'm going to start with your skin. I'm going to check your upper extremities. I'm going to check the color, temperature, nice and warm and dry, texture, condition, turgor, and your skin's elastic and you're well hydrated. I don't see any lesions anywhere. If there were, I would describe the location, size, color. I'm going to check your lower extremities, the color, temperature, they're nice and warm. I'm going to check the texture and condition. Check the turgor, they're nice and elastic. You're well hydrated. I don't see any lesions, no edema, and then check your hair distribution as well. There's no bald areas or anything. I don't see any varicose veins, and no sores, lesions. Your nails, we're going to check the color and capillary refill, which is brisk. They're in good condition. There's no clubbing. My nails are nice and hard. I'm going to same on this hand.
I don't know if I got my feet.
That's okay. I'm going to check your head. I'm going to check the size, shape of the head, nice and round. Everything appears symmetrical. I do note some ingrown hair sites and some darkened areas on the scalp. Any tender areas at all here?
No.
No bald spots. You have no bald areas, any spots or anything like that. Any tender areas on your head?
No.
On your face?
No.
Okay. Alright. Now check your paranasal sinuses. And here. Any pain at all?
No.
And here?
No.
Any pain there?
No.
Okay. I'm going to feel your jaw. Can you open and close your mouth, please? Can you move your jaw from side to side? No clicks or crepiness here?
No.
Okay. Cranial nerve 5. You're going to open and close your mouth again. Close your jaw. Clench your jaw. Okay. Move your jaw from side to side. Okay, can you feel when I touch you? Here?
Yes.
Okay. Here?
Yes.
And here?
Yes.
Okay. Cranial nerve 7 is the facial. Can you smile for me? Frown. Can you raise your eyebrows up? Puff it. Now you're going to close your eyes while I'm trying. Good job. Show your teeth. Puff out your cheeks. Purse your lips. Okay. So we would use the smelling test is for distant vision. You'd be 20 feet away from a chart. The letters would start large and go down to small. You would read from the top line down, and that would designate your distant vision. The Rosenbaum test is used for near vision. It's a handheld card that you use and read that to check for your nearsightedness. Alright, so I'm going to have you cover this eye. Hold the card for me. Now you're going to tell me when you can see that object. Look straight ahead.
I can see it.
Okay. Cover your other eye, please. Tell me when you can see.
I can see it.
Okay. Cranial nerve 3, 4, and 6. I want you to, it's the 6 cardinal fields of vision. I want you to watch the tip of the pen here. Just continue watching it. Continue watching it. I'm going to check the corneal light reflex. Look at me. So I'm checking for the reflection. Should appear, the twinkle in the eye should appear in the same spot on both sides, and it does. Okay. I want you to focus on an object behind me. This is the cover and uncover test. Okay. Focus on an object behind me, please. Okay. And the secondary eye should quickly adjust to the object that you're looking at, and it does.
Show these real quick. Well,
So I'm going to check the
move
eyebrows,
that just
eyelashes,
there.
eyebrows, eyelashes. Check to make sure everything's symmetrical. I'm going to check your iris, your cornea, your pupils. Everything should be symmetrical. Sclera is clear. Your conjunctiva is nice and pink. No redness or discharge. Okay, I'm going to check your pupil response here. Look straight ahead. Okay, I'm going to palpate your lacrimal sac. Okay, I don't have an ophthalmoscope, so what I would check the red reflex. I'm going to come at you at a 15-degree angle. Can you look at me, please? And I'm also going to look at your optic disc, the size, shape, color. I'm going to check out the retinal vessels, the color, any AV crossing. I'm going to check the retinal background, the color, and if there's any hemorrhages, all with the ophthalmoscope. I'm going to look at the macula and the fovea centralis for any irregularities or color with the ophthalmoscope. Excuse me. Ears. Alright. I'm going to look at your, check the auricle, the mastoid area behind the ear. Use the otoscope. I'm going to check the external meatus and the ear canal. Check the tympanic membrane and cone of light reflex. The malleus pars tensa pars flaccida. Okay, other side. Do the same. External meatus, the ear canal. The tympanic membrane, cone of light reflex. The malleus pars tensa pars flaccida. Okay. This is the whisper test. I want you to repeat what I say.
I want to go to the store tomorrow.
Okay. So now, if I had the tuning fork, I would do the Weber test. I'm going to bang it, hold it on the frontal portion of your head. You're going to tell me if you can hear it louder on one side or the other. And then the Rinne test, I'm going to bang it, put it on the mastoid process. And you're going to tell me when you can no longer hear it, and I'm going to time it. And then I'm going to hold the tuning fork in front of your ear to test the bone conduction versus the air conduction. The air conduction time should be 2 to 1 to the bone conduction time. That would be done with the tuning fork. I'm going to check your nose. I'm going to check your septum, your nasal mucosa turbinates.
Oh.
Checking your nose. Patency, so can you take a breath through your nose? Other side. Good sense of smell would be your cranial nerve 1. Can you, I'm going to check your mouth now. I'm going to look at your lips. Open your mouth, please. I'm going to check your mucous membranes inside your mouth. Look at your teeth and gums. Teeth look good, no broken teeth, chipped teeth. Gums are nice and pink. The Wharton's and Stinson's ducts, can you lift up your tongue for me? Look underneath the tongue and then up by the second molars. Okay, and there is good saliva production. Now have you stick your tongue down. Open your mouth. Okay, the palate rises and the uvula is midline. I don't see any lesions or anything in the throat. So you can swallow, you have a positive gag reflex, you're able to speak, that's cranial nerve 9 and 10. Can you move your tongue for me? That's cranial nerve 12. So now I'm going to check your neck. I'm going to check the symmetry, everything looks symmetrical. I'm going to palpate your cervicospinal processes and your muscles in your neck. Put your head down for me. I'm going to check your range of motion all the way back, side to side. Okay. Cranial nerve 11, put your head straight ahead. I'm going to have you lift up your shoulders against my hands. Okay. Now I want you to push your head against my hand. Good. And this way. Okay. Good. I'm going to check your trachea, so just keep your head straight ahead. I can feel your cricoid here. I'm going to check your lymph nodes. So these are the pre and post auricular nodes. The submental is here. The submandibular nodes are here. The anterior cervical chains are kind of in front of the muscles here. And then the posterior and the deep cervical chains are back here. The occipital nodes are back here. I'm going to check your carotid arteries. I'm just going to listen to your carotid arteries. I'm going to check your thyroid. I'm going to have you kind of put your head down for me and then turn slightly this way. Okay. I'm going to displace and then, can you swallow? Okay. And now you're going to go turn your head this way and then palpate the thyroid from this side. Can you swallow for me? Okay. Great. Now I'm just going to listen to your thyroid. See if I hear any bruits.